innovation and pushing boundaries are what science should be all about, and that's, I think, the only way that we affect real change. I'm Dr. Jackie Maybin. I'm a reader and honorary consultant gynaecologist at the Centre for Reproductive Health at the University of Edinburgh and NHS Lothian. I think one of the big challenges for menstrual problems is the fact that it's very difficult to speak about it, and there is a big society taboo about menstruation, and that does present challenges when you're working in the field. The sort of overall aim is to really improve things for people who are experiencing menstrual disorders. You know, some people are bleeding so heavily that they can't leave the house for 1 week out of 4, and they're missing school and work, and it has a knock-on impact. And I think there's real inequalities that people who are suffering these problems have. I think with that in mind, quite early in my career, I had to start to engage with media and really sort of facilitate that conversation around menstrual problems, and also with policymakers. I think it's really important to engage with them to raise awareness of the issues and try and really drive societal change in the area. My first interaction with the Academy was whenever I had just started my clinical lecturer job. I applied for one of their starter grants for clinical lecturers, and I didn't get it. I was gutted at the time, but in retrospect I think it's probably one of the best things that ever happened to me. Looking back at it and really having to sort of go back to that application and you know, think about how it did or didn't fit the remit, how I'd constructed it, what my big question was and how it was going to lead to the next step. I realised that I'd made lots of mistakes, and I think you often learn way more from failure than success, so I'm actually very pleased that I didn't get that. And I reworked the proposal, and that got funded, and that allowed me to really get a body of work together and finish off a piece of work that was really key to getting my clinical career development fellowship from the Wellcome Trust. So I think that just that small pot of money and having that support to pull together data when you're in a busy clinical job and things was really invaluable to that application. And I felt that my training to date had all been in the research and the clinical and how to do things myself, and what was lacking was that ability to develop other people and give them the space to really concentrate on that work while I took on all of the things to protect them, to give them space to do it. So I felt my role was now sort of more funding, managing people, trying to broaden our research and our interactions and collaborate across different sectors. And the FLIER programme came up, and I saw it on the website, and other people had kindly flagged it to me. And I just thought it ticked all those boxes on the skills that perhaps I hadn't had formal training in. My imposter syndrome went wild when I met everyone in the FLIER programme. They're an amazing group of people with really diverse skills. I think we'll probably all agree that just coming together and talking and brainstorming and venting sometimes has been probably one of the most invaluable things about the whole scheme. I think there's many ways to be an effective leader. For me, I think you have to be authentic. So I think you have to play to your strengths, and I think you have to be aware of your strengths and weaknesses. I like to keep that long-term vision in my mind of what we're trying to achieve, and then let people work towards that. For biomedical research, we need to really make sure that we are doing research that is important for society. And I think that will be a combination of hypothesis-driven research and perhaps having the flexibility for this blue sky research that recently we've seen the importance of with the development of vaccines and everything else. I think that will include acknowledgement that we need a diverse workforce, a diverse research population. We need to think about reproducibility and research integrity. I'm very positive about the future of biomedical research. I think the Academy and others are doing lots of great work to try and tackle some of the root problems that currently exist. And I would love it to be an attractive career that people love and really want to invest in, because I think that without it, we're going to really struggle.